Hi, welcome back to the LeeBella Coaching and Counseling YouTube channel. Now, this video is not part of my exam series with the 12 core functions and what you need to study to pass the counseling exam. This is simply the culmination of my experience, 33 years in long-term recovery and 19 years as an addiction counselor. What I'm talking about is what I call the CAKE model of addiction and treatment. Very simply, CAKE stands for Consider All Known Explanations. Now, I get to this because my experience with recovery dates back to the late 80s when I was in and out of rehab and in and out of sobriety. When I finally got together a little bit of sobriety and some clean time, it was through attending the 12-step fellowships. And I was pretty fanatical when it came to 12-step theory. I dove in 100%. I went to 90 meetings in 90 days. Honestly, I think I went to a meeting every day for the first 3 years. And I don't regret it. I love every minute of it. And I learned a lot about to handle my day-to-day. At the same time, and as I've mentioned in my video about the first time that I drank, AA doesn't deal with a very scientific or medical model of addiction treatment. And I think I went through a protracted post-acute withdrawal. That's the withdrawal symptoms you can have for days, weeks, months, even years after you stop using a substance. I think had I been more open to other forms of therapy and had medication been available in the early 90s like we have now, I think my recovery would have gone a little bit better. But my near fanatical adherence to 12-step principles, working all the 12 steps, going to meetings, chairing meetings, being in service, it really got me through the hump through the early days of my recovery. So when I began my journey of becoming an addiction counselor in 2006, it came from the perspective of 14 years of devout 12-step work. So when I started, I was pretty narrow-minded in my view of addiction and treatment. A little bit later, once I got a little bit more time under my belt, especially in harm reduction, I walked away entirely from 12-step approaches and started to embrace cognitive behavioral therapy and a little bit of the motivational enhancement and the stages of change. But to be honest, I simply went from one narrow view of addiction and treatment and swapped it out for another narrow view of addiction and treatment. By the time I was working on my master's degree in addiction psychology, I became exposed to all sorts of different theories. Two of the biggest that come to mind are Stanton Peele and his life experience method is kind of an existential way of addressing addiction and treatment, in which he totally disavows neurobiology, disavows 12-step approaches, and basically says that when we turn the use of drugs and we turn the term of addiction into a disease, we actually surrender our power and we just end up pathologizing everything. Another theory that I came across around the same time I was getting my master's was Gabor Mate, who wrote In the Realm of Hungry Ghosts. And for Gabor, working again in medically assisted treatment up in Canada, what he observed was that the vast majority of his patients actually suffered from trauma. So he came up with a trauma link to addiction and felt that the best way to approach recovery was to focus on not only a trauma-informed approach, but a trauma-dominant approach. Finally, I got exposed to the work of G. Alan Marlott and harm reduction. And he's the one that kind of crystallized everything for me. One of the reasons that I drifted towards harm reduction was it didn't disavow the other things. Marlott fully admits and acknowledges the effects of dopamine, the effects of neurobiology, neuroplasticity. He acknowledges 12-step approaches. He acknowledges virtually everything, right, is part of the continuum of care that can result in good outcomes. The difference between Marlott and everybody else is he wasn't obsessed on abstinence-based results. For Marlott, and I totally agree with this now, if we reduce the harm associated with substance use, if we can also reduce how much of harmful substances people are using, their method of delivery, maybe even find less harmful substitutions, we increase overall areas of functioning, we increase quality of life. And in my experience, it's a lot easier for people to fully abstain when they've gone through a period of reducing the harm. This way, they can develop their own internal motivation to stop using, and we don't have to rely on heavy-handed tactics like kicking people out of treatment or even forcing them to be on medication. Two things that I'm really concerned about in today's addiction treatment realm. Other theories that I've come across include dopaminergic theory, which I make fun of on occasion, and behaviorism. These are two ways of looking at addiction and recovery that as a professional, I don't really deal with too often. One, dopamine is involved in so many different activities, from sex to buying clothes to buying purses to gambling to video games, that yes, dopamine is involved, especially in the ventral tegmental pathway and the whole reward system. But I see no evidence that dopamine is the root cause of repeated uses of substances. For that, I go back to Stanton Peele, who points out that, hey, people use substances because they work, they change how they feel, and used in moderation, they can make them feel pretty good. Behaviorism, which is traditional operant conditioning, that's just something that my personality doesn't gel well with, so I don't deal with a lot of strict behaviorist approaches. However, I do use cognitive behavioral therapy techniques rather liberally in my practice. I'm not a cognitive behavioral therapist because that's not what I lean on. But shoot, if it's there, if it works, and it's a good fit for the client, I'm going to use it. That also includes 12-step. Come not quite full circle, but instead of being anti 12-step, nowadays I use 12-step facilitation regularly in my practice. What really changed my mind about thinking that one size fits all is when I became an instructor at a local community college while I was working on my master's degree. And again, I was very anti 12-step at the time. And to be perfectly honest, no offense to anybody, I was also pretty anti social worker. I felt that the majority of people that I worked with did not have a firm foundation in addiction treatment and addiction science, and yet they were automatically recognized as being eligible to provide services. A point of view that I actually carry to this day. Social workers are the best trained, they have the best national organization. They're completely competent and capable of providing services, to be honest, a little bit better than I am, especially when it comes to case management and dual diagnosis. Anyway, I was pretty set in my views. At the time, I was very strongly pro methadone and medically assisted treatment, and fairly not anti, but I did look down on 12-step approaches. So I began teaching a curriculum at a community college. And lo and behold, my class was filled up with social workers and people in recovery, with a smattering of mental health professionals and a couple of ministers. So in order to fully teach the class, I had to let go of all my biases. Otherwise, I wouldn't have lasted more than a month. I put together a curriculum that was focused on passing the counselor exam, and make sure that each module, each section that I did was written in such a way that they could ethically and competently apply the principles we were going over in their real job, in their real life. So I focus on being very practical. In order to be practical, I had to let go of my narrow point of view, and I had to embrace, not just admit, but really teach and explain and spend a lot of time on behaviorism, dopaminergic theory, and 12-step facilitation that I personally didn't use professionally. But in order to prepare people for the exam and to be a counselor, I have no choice. I had to cover it all. teaching that ragtag group of social workers, recovering people, and ministers was one of the greatest events in my life. In fact, that's what leads to me doing what I do today. My favorite thing in the world is to help counselors, regardless of their master's degree, regardless of their perspective. My favorite thing is to help people pass the licensing and credentialing exams. And I also provide coaching for new counselors who aren't necessarily familiar with things like the trans-theoretical stages of change and motivational interviewing. I wouldn't be doing any of that if I hadn't taught at that community college. What I understand today is everything works for someone, but nothing works for everyone. And that includes recovery coaches, which I also tend to make fun of. If you have a recovery coach who uses first principles, which is based on stoicism, and if he gets even 10 or 20 people who are able to change their life, abstain from alcohol, and get out of the trap of addiction, more power to him. I just don't happen to use that approach. And just because I don't use that approach doesn't mean that it's not effective. I do have concerns about coaches who are not qualified and have no training, but that's a whole different video series. So what's the outcome of developing the cake approach to addiction and treatment is I'm way more open-minded. And my typical day really is like that. I can work with someone who's doing harm reduction for cannabis, and I've been working with them for about 6 months, and we show steady progress. Less used per day, no longer using 7 days a week, and is starting to get a healthier social life and other interests. I can turn around the very next hour and work with somebody on 12-step facilitation, which is focused on abstinence, a spiritual means of gaining recovery, and learning how to become a service, both to fellow members of the fellowship and to society at large. And then I can pivot totally different direction and provide exam coaching and even coaching on motivational interviewing and the stages of change for my students and the people that I coach. So that's where the cake theory comes from. Consider all known explanations. And the more I know, the more I can adapt my approach to not only my patients, but also my coaching clients and my students and my clinical supervisees. And I swear it actually works. I'm a much happier clinician, and the people I work with tend to notice that I'm, well, easier to work with now that I'm no longer trying to shoot down their perspective in favor of mine. So I hope this video has been helpful. If not, hang in, like and subscribe anyway, because every thought that I have regarding what causes addiction, the course of addiction, and addiction treatment all comes back to this little thing that I created called the cake model. And if you need to hear it, it's not on the exam. It's just, hey, consider all known explanations. Be open-minded. When you're stumped by a case presentation, dig a little deeper, try to see things from your client's perspective, and consider all of the explanations. And if you're in treatment, do the same thing. Have an open mind. Like they say in the rooms, take the cotton out of your... Anyway, I'm not a big fan of that saying. So those are the beginning of my thoughts on cake. Let me know what you think in the comments below. And please like and subscribe. Stay tuned for more content from LeeBella Coaching and Counseling. Until next time, see ya.